Hey guys, how are you? So, once again, I mentioned this last time I went live. I've been really neglecting my Feel Good Fridays, but I don't really feel bad because I be going live when I'm like traveling and doing stuff. And y'all know my life has been crazy, right? Like crazy. Um, in the past 30 days, two family deaths. I was rear-ended, and I already had on the books a surgery that is tomorrow. I gotta be there at 5:15 in the morning. So as usual, as I do with just about everything, I'm sharing with you guys information on how I'm preparing for surgery, both um, naturally and just reading you literally what the hospital told me I need to do to prepare for surgery. So TMI for the men on my timeline, but I'm always open about this and have done some lives on this before. I'm currently thriving, and I truly mean thriving through fibroids because had them before. 7 years ago, I had a procedure, and I was miserable. By the time I got to the procedure, I was in constant pain. I was an emotional, miserable wreck. I was bleeding 25 days out of the month, y'all. It was horrible, absolutely horrible when I had no natural assistance whatsoever. And so this time around, I started to have some issues at the very beginning of 2020 with the way the world changed in March. I couldn't really get into anyone. I kept pushing and advocating for myself, and it took about a year to find out that I actually had them again. And as a consequence, my hemoglobin went down to 7.1. I didn't even know I had no iron in my system. I didn't even know because I was compensating with all of my natural things. I was just pumping myself with more vitamins and natural caffeine. That's why it's always important to go to your doctor because you need those checkups, and it's always a combination of natural and making sure you have all the tests and be working with a medical professional always. So at this point in time, I had gotten to a point where I was have like between 2 and 4 miserable days during my cycle. And my cycle was actually getting a little bit shorter, which again, last time it got shorter until I was just pretty much bleeding all the time. So usually it's between 25 and 28 days when I exercise a lot. Usually it's longer. And now it's been down to like 23 days. And so it would be dangerous if it gets shorter and shorter because that would mean more bleeding. So that's the one thing, one of like two, and then 2 to 4 days I am like miserable, y'all. Like before I had fibroids, I never had any issues with my cycle. And like I didn't even know that ultra tampons existed. I didn't even know that. And so I was going through like a ultra in like 30 minutes. Like 30 minutes. That's what it's been happening. And I found some natural things to support and give me a little bit better. But with the issues that can happen with my hemoglobin being low, it's really important to take care of it. And so I'm taking the doctor's advice, and I'm having a robotic assisted myomectomy. So they're going to have a small robot. They're going to go into my stomach. They're going to have a camera, and they're going to pull out the fibroids. And it is outpatient surgery, so it is a minor surgery. And now I got to prep for it, right? So it's tomorrow. So again, I'm just going to read you guys 12 steps to a safer surgery right from the Henry Ford Health System of things to keep in mind. Because that's what I do, is I share as a holistic wellness coach ways for you to both naturally and logically deal with things. So, first one, stop smoking. Smoking increases your chances of developing pneumonia and breathing difficulty after surgery. Stopping smoking will make your surgery safer and improve your quality of life. Walk daily. Walking strengthens your heart and lungs in preparation for surgery. After surgery, get out of bed and walk every hour to reduce the chances of developing pneumonia and blood clots. And so I'm going to have some other information after when I'm recovering. So it's interesting. You guys know I was in an accident. So I usually do walk daily, but I haven't been exercising as much, but I did get some exercise in like every other day. Control diabetes, take medications, follow an appropriate diet, and check blood sugars. Uncontrolled diabetes increases complications from surgery. So thankfully, I don't have diabetes. At one point in time, I was testing as pre-diabetic, but by using my scan and eating exactly what I needed for my scan, that is now gone, which is wonderful. Eat and drink well. Eat enough protein and avoid high sugar and high fat foods. Eat whole grains, fruits, vegetables. Drink enough water and avoid excessive amounts of soda, alcohol, and caffeinated beverages. Of course, we should do that all the time, right? But of course, it's really important during this time. Number 5 is an incentive spirometer. Using an incentive spirometer correctly several times a day for 2 weeks before surgery strengthens your respiratory muscles and improves your lung function. While in the hospital, using this spirometer can help reduce your risk of pneumonia. That's this thing. I probably should have pulled this out and looked at it before because I haven't been using it. But I guess I'll be using it afterwards and when I'm in the hospital. Coughing and deep breathing. These activities move mucus out of your system, strengthen respiratory muscles, and clear your lungs. This is especially important after surgery. So I actually some of my Web3 friends that are friends on Twitter just did an amazing mindfulness session for me so that I can get in the right state of mind and be calm. And it was great. So I will continue my deep breathing. I actually had a massage yesterday, which was so helpful because I have not been able to take any of my supplements this week. So I've been a lot more pain in my neck, a lot more pain in my back from being rear-ended recently. So having the massage helped, but it actually brought up some mucus. And so I was like, yeah, I got to cough that stuff up. So really important. Oral hygiene. Bacteria in the mouth can be a critical factor in the development of pneumonia. Dental plaque provides a perfect place for bacteria to grow. Brush your teeth with toothpaste and rinse with special mouthwash provided the evening before and the morning of surgery. So this is my special mouthwash that I gotta use. I didn't even know that. Use special soaps. Skin is not sterile and it is important to remove bacteria that are normally on your skin. This prevents the bacteria from entering the surgical incision and causing an infection. Shower or bathe for one night prior to, as well the morning of, your surgery using special soap provided. So here's my special soap. It's going to make me all sterile. Keep your head up. In addition to using the incentive spirometer, after surgery, try to sit in a chair with your head upright as much as possible instead of lying in bed. Duh. You know I don't like to lie. If I'm lying down, I'm sleeping. And I know I don't like to sit around. So y'all gonna need to give me some stuff to do. Y'all know how I am. I stay busy. But anyways, catch up on rewatching some movies. I don't know. We gonna see. Blood tests. Lab tests may be ordered before your surgery. If you are anemic and have a low blood count, talk to your physician about how to correct these problems before your surgery. So I did my blood test yesterday. Unfortunately, my hemoglobin is a little bit low. It's 11.3. They told me I could still take my stuff for it. So I got to make sure that I take my Floretics and my Ninja Red. That was my issue. Like when I travel, sometimes then I don't take it. I really needed to have gotten my Floretics when I was traveling. I did try to eat like red meat a lot or meat while I was out, but I should have my Floretics. But taking it and will continue to take it. Nasal swab. A nasal swab test may be performed to screen you for bacteria that frequently resides on the skin and in the nasal passages of healthy people. It does not cause problems for most people, but sometimes these germs can cause serious infections, including surgical wound infections. Screening for bacteria reduces the risk of post-operative infection. Speak up! Be your own best advocate. Be sure you understand your diagnosis and the treatment plan involved. Speak up if there is something you don't understand. So those are 12 steps to a safer surgery that I reviewed before I have my surgery tomorrow. From the Henry Ford Health System, Simple Steps for Safer Surgery, Surgery Patient Guide. And then there's some stuff, some more details there of, how to use all the stuff and the mouthwash and the soap. And then what to do afterwards. They want me to walk every day, which I will definitely do. Oh, and look, in the back of it, they have my successful surgery log, So I can like mark on here taking a walk once or twice a day, making sure I drink 8 glasses of water, using the incentive spirometer, making sure I shower, and making sure I do the mouthwash. So yeah, I got a little checklist, so that's cool. Oh, I forgot. As you guys come on here, give me a hi, a wave, a hello. Let me know what city, state, or country you're watching me from, and hashtag replay as you watch the replay, no matter what venue it's on. And then, of course, y'all, what I'm taking on the natural side with me, first of all, my vitamins. Like, I can't even tell you guys, like, the brain fog, the not being able to concentrate. Like, this is horrible. Horrible being off my whole food nutriments, and I can't not wait. I'm taking them with me to the hospital, so I need to take them as soon as I'm conscious again so that I can feel better, because they're just so life-changing. If you have not got your scan from me that tells you exactly the food and the supplements that your body needs, literally, this was a huge reminder to me that when I don't take them, what a difference it's making. Of course, having a diffuser everywhere you go and in your life, it's just using aromatherapy is the fastest and best way to affect your emotions. So taking my little travel one, this is what I take to hotels usually, and I'm going to try to have that going as long as they will let me. Because I'm going to be in the prep area for like 2 hours, y'all, before they start on me. I got to be there at 5:15, and then they start at 7:15. It's crazy. So to keep me calm, put something like joy, something really uplifting in there. And then just some other things that I'm going to have on hand that are really relaxing, have been known to be supportive for feminine stuff, are like geranium, as well as things that come up on my scan. Endoflex. Copaiba is just a really good one. You can take it internally for just overall wellness. So it's going to be super, super good for this. And then, and then GLF, this is going to be really good, really strong and really good for my stomach support, because that's where they're going to be going in. And then Cistus and frankincense, and I think I didn't bring it over here, helichrysum. Some other good, just really, really supporting ones that I'm going to take all this in my bag, my prep bag, when I go to the hospital tomorrow. So, keeping everyone updated like I do, as well as, like I said, I was reading the instructions for myself and I just share it with the world. So send me good vibes, prayers, all the good things. This is a surgery that was scheduled 2 months ago, and not related whatsoever to my accident, to me getting rear-ended. So on June 6th, I go in for my assessment because they couldn't get me in until June, which was after my surgery. So June 6th, I go in for my assessment for my 6 weeks of physical therapy for the accident. June 7th, I go in for my review of how I'm doing after the surgery. So this is my life currently. Very busy, but we just use the tools that we can to keep going. Prayer, support from friends and family, all of the neuroscience techniques to keep as much happy while allowing, us to release the emotions that we do, and just do all the things. So thank you guys again for joining me. Don't forget to say hi, hello, wave. Let me know what city, state, or country you're watching me from, and hashtag replay. Definitely go check back the replay. Again, what we're talking about today was how to prepare for a surgery. In this case, this is going to be a robotic surgery on my stomach. So this is some tips directly from the hospital, as well as some natural things that I'm doing to support myself. Thank you guys so much for joining me. And I'll be back again with post-op stuff and some other fun things for you as we go along. Bye, guys.